Hello guys, my name is Adil and you are watching the Biomed 2. Today we are discuss about the CTG machine. I have a complete presentation about that. So let's get started. So I'm on screen now. Today topic is cardiotocography machine. Here is the cardiotocography machine, and here is the CTG recording, and here is a troco and ultrasound transducer. Here is the patient where we applied the cardiotocography machine. So in this the content of this video is introducing and uses of the CTG machine, different types of the CTG machine, detail of the transducer, and working principle, accessories detail, and the output graph explain as well. So the first slide is the definition and uses of the CTG machine. A continuous recording of a fetal heart rate obtained via an ultrasound transducer placed on the mother abdomen is called CTG. So the cardiotocography CTG is used during pregnancy to monitor fetal heart rate and uterine contractions. Uterine contraction, the movement of the uterines, like the movement of the in the simple words, the movement of the baby. It's measure your baby heart rate at the same time. It is also monitoring the contraction in the womb or uterus. It is most commonly used in the third trimester, and its purpose is to monitor fetal well-being and allow early detection of the fetal distress. So here is the different types of CTG machine which are commonly used. Like this is the GE CTG machine. Here is the Bistos, and here is the some other company CTG machine where the transducer display on the screen. So the next slides I am explaining about the cardio and toco transducer. About what is cardio and toco transducers. Toco prefix meanings childbirth. For example, tocolysis is the showing of halting of a labor. CTG use sound wave called ultrasound to detect the baby heart rate. So the ultrasound is a high frequency sound that you cannot hear about, but it can be sent out and detected by special machine. Ultrasound travel freely through fluid and soft tissues. So these are the difference between cardio and toco transducers. So here in the slide, here is the display the external indirect monitoring system. Here is two transducers applied on the mother abdomen. Here is the toco probe, and here is the ultrasound probes. So the toco is placed over the uterine fundus. The toco provides information that can be used to monitor uterine contractions. So here is the ultrasound probe. The ultrasound device is placed over the area of the fetal bag. This device information transmitter information about the FHR. So the next slide is why the purpose of CTG recording is to identify when there is a concern about fetal well-being, to allow intervention to be carried out before the fetal is harmed. The focus is identifying fetal heart rate FSH pattern associated with inadequate oxygen supply to the fetal. There are two methods of fetal heart rate monitoring: external and internal. The external heart rate monitoring uses a device to listen or to record the fetal heartbeat through the mother abdomen. The internal fetal heart rate monitoring used to electronic transducer concerned directly to the fetal skin. So here is two different types of transducer where we use the internal monitoring system, and this is the external monitoring system. In the internal monitoring system, fetal scale electrode and internal fetal heart rate monitoring. So here is the internal structure, and here in the external structures. So in this slide, the external transducer applied to the mother abdomen. Here is the transducer scanning uterine contractions, and here is the transducer scanning for fetal heart rates. And here is the fetal heart rate applied, and here is the uterus and the contractions applied to the mother abdomen. And here is the CTG machines. So this is in this slide I am showing you that CTG machine and different parts of this CTG machine, and here is this two different transducers, and this is the connector and sockets of this transducer. and here is the different switches or button. Here is the paper draws, and here is the indication for charging and power battery indications, and here is the knob connector, and here is the display where we display the graph and the numeric display of the fetal informations, and here is the indication if some alarm occurs. So if I talking about the accessories of the machine, so here is the main unit, and here is three different transducers, two for babies, two for babies heart rate, or twins baby, or one for tocography, and three belts, and here is the marker for any movement of the baby. Here is a power adapter, power cable, and gel, etc. Here is one of the CTG machine display where we can show the mode frame and the graph frame, where the twins baby or single baby graph heartbeat showing here. Here is the numeric display of the baby, and is the graph trends frames, and here the display the date and time of the unit, and is the status indicator, either the CTG is printing or not, or the CTG printing speed 3 centimeter or 1 centimeter as per requirement. So here is the message indicator, and here is the UC numeric display and FHR numeric display. Here is the ID if we applied for the patient ID. So the next slide is the display and the output graph. Here is uh, the fetal heart rate tracing display on the upper plane, and uterine activity is display in the lower plane. So two different planes where are patient information here. So here is the interval between the vertical red line represent 1 minute. So if this is 1 minute, this is 2, 3, and 4, and the all patient information here, where when the all patient information here, and the doctor decide for the treatment and other then the doctor decide for the all 1 minute and other 15-minute and 20-minute information here, then the doctor decide for the next treatment. So here is the next slide where we display the central monitoring system, or which are not commonly used, but this is the cardiotocography machine, and here is the modem, and here is the CTG trace, and the operation center where the doctor display the monitoring of the fetal heart rate, and here is the computerized CTG and output report, and medical report. After that the report sent to the internet and display on the anywhere in the world. So to guys, this is all about CTG machine, and hope you learn about it. If you have any question, you can ask me on the comment section. If you learn about the repairing of this CTG machine, you can check the link on the description. Thank you very much for watching.